Hello, everyone, and welcome to yet another episode of MedPod. I am Dr. Sanjay. At MedPod, we are committed to create health related awareness among the general public. I know medical terminology can be a bit difficult, however, we'll try to keep it at the simplest language as possible. So, let's jump right into the video. Today's topic of concern is something that has been causing panic in the past few days. The COVID is back, yes, as a new variant, the JN1 variant. COVID is something that has touched our lives since the 2020s, and now it's back again. We are going to talk about what COVID is, what was it like in 2020, and what has changed over the years, and now in 2025, what is new. Let's understand what coronavirus is. Coronavirus is a family of viruses which have an RNA instead of a DNA. DNA is a genetic material which is present inside our cells. So this virus harbors RNA as its genetic material. So there is a property of these viruses by virtue of which they can have mutations inside the RNA, which is why the new variants pop up once in a while. We saw different variants coming up throughout the years. The first virus, the COVID virus, which came in the late 2019, starting from Wuhan, China, and then spread all over the world in a span of few months. It was also called the SARS-CoV-2. That was a deadly virus and it claimed a lot of lives, caused serious infections and a global pandemic. We saw lockdown, social distancing, mass, fear, and resilience. Countries like Italy, India, the United States, and Brazil saw massive surges. Hospitals were full, ICUs were literally unavailable. Doctors and nurses had to work round the clock, and every one of us learned what it meant to live through a pandemic. Vaccines came out in the late 20s and early 21, and it was indeed a turning point. Vaccines saved millions of lives and prevented serious infections. And within a year or so, everything came back to its normal pace. Then came the variants of COVID, the Alpha variant, the Beta variant, the Delta, and Omicron. Each variant brought different challenges. However, vaccines, yes, they helped us fight all these infections. The Alpha variant came soon followed by the Delta variant, which was more severe. We saw that during the India's deadly second wave, Omicron emerged in the late 21, spread faster, but posed mild infections, and it almost changed the way how we looked at COVID. More of a live with it kind of approach began. COVID is no longer a global emergency, but it hadn't disappeared. It has become something to be monitored more like a flu. Most of us now developed the immunity against COVID. However, there are still obstacles. All this doesn't mean that COVID is not harmless. It is harmless, but not to people who are more vulnerable. The good news is the vaccines work. Treatments like antivirals are available, and we are much more prepared today. So, what are the symptoms today? They are often milder in healthy and vaccinated individuals. Common symptoms are fever, chills, body ache, cough, sore throat, tiredness, and a few suffer from loss of taste and smell. Sometimes it is accompanied by diarrhea or vomiting. Elderly people, people with chronic diseases, immunocompromised patients, they often suffer from serious illness. They can amount to severe respiratory distress and even death. COVID can cause pneumonia, blood clots, heart issues, or even brain fog, especially in individuals who are vulnerable, as I said, immunocompromised elderly. These symptoms are, however, much less common with the 2025 variant. However, if you or your loved ones are suffering from these symptoms, seek professional help immediately. We have moved beyond total lockdowns, and we all know the basics of prevention, and we are vaccinated against COVID virus. However, we have to still maintain a lot of precautions, like stay home if you're sick, maintain hand hygiene, wear masks, avoid social gatherings as much as possible, and also avoid overcrowding. Take your COVID booster vaccines, especially if you are at high risk and if you are eligible for a booster vaccine. These simple steps can prevent serious illnesses. You all might have heard the term immunocompromised. In this video also have used the term multiple times. Let's just break down what immunocompromised means in general. Our body is generally protected against all sorts of infections, bacteria, viruses, fungus, and parasites by a group of cells called the WBCs, especially lymphocytes. These cells and the other bodily mechanisms fights of infections and foreign bodies. But and a particular group of people, when they take in drugs that can destroy their immunity, or they got an infection like the human immunodeficiency virus, HIV, which breaks down their immunity, and with age, immunity, we say with age, everything wanes off. So immunity also wanes off when a person ages, and our food habits, our exercises, everything has to do with immunity. So when this immunity wanes off, these cells stops functioning and the bodily mechanisms are exposed. So when an infection comes in, it's quite easy for it to establish its niche within our body. So basically, immunocompromise means any sort of organism that gets inside our body will grow fast and can cause serious complications. Immunocompromised people are elderly, especially if they are over 65 or 70 years of age. Those patients with cancer, patients who receive immunocompromised, people who are on steroids, people with uncontrolled diabetes, people with HIV/AIDS, and transplant recipients. We need to know how to support people with immunocompromised state and how to fight off such infections. The most important thing is prevention. The steps that we can take for are encourage vaccination and booster doses. Avoid visiting them quite often, especially when they are unwell. Make sure medications and nutrition is well managed. Help them attend telemedicine consultations and educate the caregivers. By taking these steps promptly, we can help the immunocompromised people from getting infected with viruses and bacteria. So, to sum up, the COVID infection in 2025 may not be very serious, but it still is contagious. And we need to take all the preventive steps to stop further contagiousness or the spread of the virus to people who are more susceptible. So, be a responsible citizen, follow general guidelines by keeping your hand hygiene, wear masks when in a public place, avoid social gatherings and meetings whenever possible, and also, if you're eligible and if you're susceptible, take your booster vaccines. Somebody who's suffering from COVID infection or some respiratory illness, which is bound to become serious, immediate professional help. That's how we prevent further spread and further panic in our community. So I hope everyone understood what is the state of COVID now, and I hope you will all follow the precautionary steps to prevent further spread of COVID. If you like this video, please leave a like, share, and subscribe. And let us know in the comments what topic you would like to have us talk about in the next video. I'm Dr. Sanjay, signing off.